Why weight loss matters for piles relief. Being overweight or obese can increase the chances of developing hemorrhoids or make existing ones more uncomfortable. The extra weight, especially around the belly, puts pressure on the blood vessels near the bottom, leading to hemorrhoids. Additionally, overweight individuals may struggle with constipation due to a lack of physical activity and a diet lacking in fiber-rich foods. This can result in straining during bowel movements, further irritating hemorrhoids. Furthermore, obesity can cause inflammation in the body, making the blood vessels around the bottom more likely to swell and become hemorrhoids. Losing weight is crucial for overweight individuals with hemorrhoids. Shedding those extra pounds reduces the pressure on the blood vessels near the bottom, providing relief. Moreover, weight loss, along with a healthier diet and increased physical activity, can improve bowel movements, making them easier and reducing the strain on hemorrhoids. Losing weight also improves blood flow, reducing the risk of hemorrhoids. Additionally, weight loss helps reduce chronic inflammation in the body, making hemorrhoids less likely. For more details, contact Dr. Tulip Stodds at 988-613-9999.